Namaste. I'm Dr. Uttam Tambe from Navkaar Hospital. I'm an orthopedic surgeon. Now, currently we talk about knee replacement, and if you have been advised for a knee replacement, first, as a patient, everybody is scared to undergo the surgery, and you feel that you're going to be bedridden completely for months together, and whether your knee is going to be your own bone, your own thing, or it's just going to be a straight robotic leg kind of a thing. This is not so. Let's just clear the myths over here about total knee replacement and how we go about it. And as a patient, how you all have to take it and what do we all explain to you. We'll talk about all those things shortly in this video. So what exactly are we doing when you're doing a replacement? There are two surfaces of the bone. When they come together, they form a joint. Now they are protected with cartilage as smooth, so the movement is smooth. So whatever happens in arthritis is this surface becomes eroded or maybe uneven, and then the grinding doesn't happen smoothly. So we are going to only shave off or maybe cut off the surface and replace it or resurface it with another implant. Now the mobility becomes smooth over there. So now there is smooth surfaces either side of the bone. Cartilage which was damaged, we have removed it and we have replaced it with a surface over it. So now we talk about patients and who are eligible, as in what you feel like when should you go ahead with total knee replacement. Primary what you need to look about is you are suffering from knee pain, you have tried everything, you have tried your oil massages, home remedies, you've been to a doctor, he's advised you physiotherapy, exercises, he's given you medications, and everything has not helped. The pain comes back when you stop all those things. So that is one criteria that you need to go ahead with the replacement surgery. Secondly, if the pain has become very unbearable, that you're not able to sleep in the night, you have to get up in the night. Sometimes, taking care of your daily activity like going to the washroom, moving around in the house, or maybe you're on the road and you're not able to get down on the footpath, or you're not confident enough to walk that speed while crossing the road, all those things are going to be painful. And if that is hampering your daily activity, I think you should go ahead with knee replacement. So the common concerns once you decide yourself for going ahead with knee replacements, primarily you think you're too old enough to undergo surgery. Someone who's 75 plus or something like that. You're like, we don't have a life now, we're just moving around in the house. But whatever life you have, do not have to be dependent on anybody. Second concern would be, how much is it going to pain? Then will I be bedridden? For how long will I be bedridden? When can I resume my activity? Will I need help of anybody to walk? And over all this, how much is the surgery going to cause me the pain? So let me come to this. Let's say age is not a criteria. As long as you're medically fit, surgically fit for surgery, we always will advise you to go ahead with surgery. Second, the part of pain. Pain is usually going to be there, but with the current medicines available for us, what we do is we have a lot of root blocks, nerve blocks, long-acting local anesthetics, which we use to give you so that the pain is brought down to the minimum. You would never bedridden when we do a total knee replacement. We want you, this procedure is done so that you walk comfortably, and if possible, you walk on the very same day or maybe the next day. So the pain will be taken care of. You need to get mobile. There is no way that you're going to be on the bed for months together or anything. Your activity starts as soon as your pain comes down, and that is going to be a day or two. And you'll be back on your feet and happy and smiling. And the last most concerning thing is, how long is this knee going to last in my leg? So it's naturally, if I have to say, I would say how well you take care of your knee is how much it is going to last. Maximum to maximum 15 to 20 years that we've seen that the implants last inside. Some wear and tear of daily usage is there. If it gives problem, yes, we can always change that thing to a newer one. It's as good as changing your old tires of your car and getting the new tires, and you are back on your feet again. So lasting wise, maximum to maximum 15 to 20 years that I'm seeing your knee is going to last. Will I be normal again? Yes, you are going to be normal, but this normal is going to be the new normal. You might hear a few clicks, some cracking sounds, some metal grinding kind of thing in your knee, but that is quite normal. Once you regain the strength of your muscles back, all those things goes off. Kneeling down is going to be a bit difficult. Squatting down is going to be difficult. Sitting cross-legged is going to be difficult, but all these things can be achieved over a period of time, and it will be a new normal. The activities which you restricted for yourself crossing the roads, climbing the stairs, maybe walking on the road quick enough to cross the road. All these things becomes much simpler. Your pain, which was the major concerning part for this, is out. You have a happy, satisfied life. That is what the aim of the surgery is, to get back on your feet and start moving around. So we at Navkaar over here are doing regular knee replacements. Our patients vary from the age of 50 to 90. We've been doing, and all our patients have gone home walking, smiling, come back to us with few other patients who are now willing, seeing them, to get a surgery done. Team of Navkaar is doing a great job in replacements. We have a full-time physiotherapist, we have our ICU backups, we have our physicians around the clock over here, and the orthopedic surgeons helping you, guiding you, and telling you what you're going to go through in this phase of your knee replacement.